So I'm here with Dr. Bernardo Merizalde, who's a physician, a psychiatrist, a homeopath, a hypnotist, and so much more. He's really a guru in mind-body medicine, and he's one of our key speakers at the Mind-Body Medicine Conference that we're hosting at the Marcus Institute at Thomas Jefferson University. So Dr. Merizalde, you've seen a lot of evolution of this field of mind-body medicine. Would love to hear your perspective of how you currently define it and what it's looking like for you.
Oh my, that's a long story because I really started studying this back 45 years ago. And at that time, there was nothing called mind-body medicine at that time. But because of my background in the tradition, there was a lot of spirituality, not so much religion, but more spirituality. And so at that time, I started studying meditation. And I started, when practicing medicine, I started realizing that people were coming with the same drugs, same medicines for years and years and years. And I just felt there was something missing. So in seeing what was missing, I decided to start studying more about that from different areas. There was no one place where I could find everything. Then went to psychiatry because at that time I wanted to learn more about how to help the mind, how to help psychological problems and do psychotherapy. And I was very lucky because it was at Hahnemann Hospital. I was probably one of the last promotions that actually taught psychoanalytically oriented psychotherapy. But I was also interested in Jungian analysis, so I was studying that as well. In Philadelphia, I had a great group to study that. So I started learning more about the psyche, and of course, in Jungian analysis, there's the concept of the collective unconscious, and there's a spiritual dimension which goes beyond what psychoanalysis goes. So that's what I started doing with my patients, and I started then applying nutritional medicine and supplementation and homeopathic medicine, and then I studied hypnosis. And that's what I've been doing. So what I've been seeing in the past, I would say probably last 20 years, especially 20, 25 years, it has grown and grown and grown. There was the American Board of Integrative Medicine and conferences all over the place. And then, of course, Thomas Jefferson University's Center for Integrative Medicine, and where you actually recruited me way back at that time, even before it was even...
Before we were a department or even an institute.
Right,
yes.
Right. So just seeing it is so encouraging. I was taking the right path and moving in the right direction. And I found that people are happier that way. It has been really fantastic to see how the field has expanded and how people have these greater options. And many times they will come to me and find it interesting, but then they go back to their conventional doctors to do what they do normally. And then they decide to come back because they like better that integrated approach. So when I meet with people, I look at what are the biological factors, what their genetic makeup is, their family histories, and so forth. I will look at the social and environmental elements with which they grew up and see how that may be affecting their life. Then look at the emotional, psychological growth, maturation. And then I talk about spirituality. And I have been amazed at the response that people really want to talk about that. And not many doctors still talk to them about their spiritual beliefs and their system. So I have made my point to study different traditions because when somebody comes to me from another tradition, I want to make sure that at least I understand a little bit about where they're coming from, their mindset, because that's very important. Whether I am understanding their condition, their medical condition, how they may see their medical condition being related to their spiritual dimension of being, and then when I'm approaching with guided imagery or hypnosis, that I'm able to frame different suggestions that are in line with their belief systems, that enhances their own buy-in into the healing process.
What's really terrific is there's been such an evolving science that validates a lot of the things you're talking about. Some of the brain imaging studies that we've all done at the Marcus Institute that show the brain changes when people meditate, engage in spiritual practices, and how diet affects inflammation, which affects depression and mood and those other kinds of things. How do you see that has impacted the way people then approach some of the things you do with them?
I think being able to verify for them that this is something that is not just a belief system, that is something that is grounded on evidence, I think reassures people that want to have that perspective. Because there are people that already know or have this feeling, this intuition that this system would work. But there are others that are not quite sure. So having the evidence, they want to know more about that. So being able to offer them, listen, there are these articles that I can share with you. If you have a hard time really seeing how this could work for you, then maybe you can read a little bit. So depending on the temperament of the patient, then you may be offering one perspective or another, or data that is more experiential, more felt experience and anecdotal, which would be fine for them, but others want the hard data.
Because all that data, you didn't have it 45 years ago when you started on this journey.
Not even 20 years ago.
Right, not even 20 years ago. So it was a much more complicated conversation because you saw the results of a mind-body approach, but it was difficult to probably convince some people that wanted to see that data.
Right. And it is still, even with such an amount of information that has been out there, published in the greatest journals, you still talk about mindfulness, meditations like, really? I can't do that. My mind just rushes and I can't stop my mind from just running around. Well, that happens to everybody. It happens to me. I've been meditating now for 40 years. I still have to sit down and calm my mind. It just doesn't go away. You just are able to learn to do it quicker. So that makes a big difference.
That's great. And so for the average person who's on their own mind-body journey, what are some of the things you'd recommend that the average person does or tries?
There are different books that I recommend. YouTube videos now, like now you do a search on YouTube and you find a lot of material. And I think the work that you're doing is phenomenal because it is providing this information to people that in a way that is coming from a reputable institution, from a reputable group of researchers and scientists that are providing these results. So I think that is incredible. So giving them the sources of information is the best thing that I can do for people. And just putting it out there is really, really important.
Would you recommend, for example, that most people try a meditation practice, such as mindfulness or something else that resonates with them?
When I talk to them and I look at what hobbies they have and what their interests are, then I try to align their interests with a form of what could be meditation. My wife, for example, we've met now 36 years, and it has taken me this long to get her to meditate. She still doesn't sit down to meditate. For her, meditation is going on the garden. So I said, well, that's okay. Just go to the garden, be very mindful, and use your breathing, and just connect with that. Or go for a walk in nature and use that as a meditation. So at least you can start experiencing what that is like. And then little by little, they start kind of being able to quiet their mind and they may be ready to do 3-minute meditation, which is what I do. Right? Many times I will record a 3-minute meditation and I have to listen to these 3 minutes, just 3 minutes. And when you are in your day, you feel really frazzled, pause. Just like you sometimes need to pause because your computer has too many windows open. Just pause and just take a few nice deep breaths and just let go and release. And then you'll be resetting yourself to get back into your task and you'll be more effective and more efficient that way.
So I know you're a top expert in hypnosis and many people are very interested in and intrigued by the topic of hypnosis. How would you define hypnosis?
It has a checkered history because, it started way back. One of the first ones was Antoine Mesmer in France that was doing animal magnetism, and he was doing passes on people, and he believed that there was some magnetic force that he was passing on.
That's why we have the term mesmerize.
Mesmerized, right. And Benjamin Franklin went, part of the commission to France to debunk him, and they did. They said, no, there's no animal magnetism. This is just suggestion that this person is using. But now some of the Reiki practitioners would say no, Mesmer did have some animal magnetism. There's some energy there. Now we have these quantum healers there may be something behind it. We don't have the research yet, but we know that many people find the efficacy of these procedures. So we really don't know. But yet back then when science was really strong, then it was just a suggestion. So then other researchers have come about and basically that name hypnosis, which means inducing sleep, is kind of the term that continued. So it's look at the pendulum, now you're going to fall asleep, and deeper and deeper. Yes. And that's what they think. And that's the stage performance of hypnosis. But that's not really what it is. So hypnosis is just a state of focused concentration. And as far as it has been proven, nobody can be hypnotized if they don't want to. So nobody will go into trance if they don't want to be in trance. Otherwise, they'll be in Wall Street and in Washington by the millions, because then, or different armies would have had a group of hypnotists kind of doing that with their prisoners of war. And they tried. The Manchurian Candidate, a very famous film where supposedly they hypnotized a person to infiltrate the US government. And in reality, that was tried, but it never worked because it doesn't work that way. You have to have a willingness to go into that state of being.
And how is that helpful in a therapeutic setting?
When you are alert and really busy, or you are very anxious and agitated, the brain is going to be functioning at that level. So when you're able to slow down and using your breath, then your brain waves start to calm down and your nervous system starts to wire down. You turn off or turn down the sympathetic nervous system, which is the fight-flight response system, and you turn on the parasympathetic, which is the relaxation response system. And that system is for calmness, for peacefulness. So heart rate decreases, blood pressure decreases, tension, all the hormones that the neurotransmitters have to do with stress response dial down, cortisol comes down. So that you're able to reduce that wear and tear. That is what disease is wear, tear, and inflammation. So entering into that state, be it through hypnosis or being through mindfulness-based training, which are very similar. Basically, it's a similar state. We know now neurologically they're very much the same. The difference is that mindfulness is more following a particular protocol, that you are entering into that space, becoming aware of your mind. With hypnosis, then with the help of a therapist, then you can use different suggestions. So for example, now feel your breathing, feel the air going into your lungs and your lungs becoming easier and easier to expand for a person that has asthma, for example. Or for a person that has some problem with high blood pressure, just imagine now your arteries becoming dilated, so it reduces the burden on your heart. So you can use the imagery, which is not used usually in mindfulness. So with hypnosis, you can have different protocols that could be helpful for different conditions.
Are there particular conditions that you found can really be helped with hypnosis?
Yes, sure. I mean, chronic pain is one of the ones. In fact, there's a lot of research showing that with hypnosis, there can be a reduction in the use of narcotics. In fact, sometimes even without any narcotics, you can treat pain.
So in doing the hypnosis, say with somebody with pain, you get them into that relaxed, almost meditative state. And then what does the therapist do as the additional step?
Is help them to guide them. So they say, no, my pain is here. So you say, now focus on your left shoulder and now feel what your left shoulder is like, or your left hand. So by guiding the person, because the person has gotten used to a particular pain and will continue focusing on that pain, so gets attached
to that. So you disconnect them from the focus they have on the painful area.
Yes. And changing the sensations. It is a bird, so you want to take out detailed history and what does it feel like. So then you can use what adjectives the person is using, what kind of dynamics they're operating under, and you help them change that narrative. That is difficult for them to change by themselves.
Great.
But through collaboration, it can be done.
And what about hypnosis for smoking cessation? Does it work?
Absolutely. It's one of the areas that has been worked, because with substance abuse, you have narcotics, you have alcoholism, you have, of course, tobacco. And there's an incredible amount of research. And actually, Thomas Jefferson has the Quit Smart program for nicotine addiction, because it is very, very helpful. And nicotine is a really interesting drug. It's the most addicting drug because it's a chameleon drug. Because nicotine works on both the sympathetic and the parasympathetic system. So that when you're trying to relax and you smoke, it will enhance that particular way of functioning of nicotine. And if you want to get excited and do something active, then you smoke and it will stimulate that pathway. So it can go either way, through relaxation and tranquility or towards stimulation. That's why it's a chameleon drug. So it's the hardest drug to quit. But then by using breathing techniques and by relaxation, then you can then help people start to quit smoking.
And so in the hypnosis, is there certain suggestions that usually are helpful?
You want to know what are the circumstances that lead a person to smoke. And then you want to help them reframe those particular experiences.
During the hypnotic experience.
Yes.
Oh, very interesting.
So I think the main goal about hypnosis is being able to provide a person a new perspective. People come in with a certain mindset, and they believe that's it. And they are married to that perspective because they've been on it for so long. And when you have them say, well, what if you look at this from this perspective? How would that feel to you? Would that offer you a benefit? And they will say like, that sounds interesting. I'll be willing to try it. And not everybody will, but I think a good number of people may see the benefit of looking at things differently for their own benefit, so they can heal, they can feel better.
And it sounds like a great place for a lot of people to start would be to actually go on their own journey of self-reflection, meditation, even spirituality.
And the advantage is that it's cheap, doesn't cost them any more, just takes a little bit more personal effort, doesn't have any side effects, and you can go for a long time. It can change the brain forever so that you don't need to go back. You can continue advancing and feeling better and have a better perspective of life and maybe relate better to people. So I think that overall, I think is the most cost-effective strategy that we have for healthcare.
Well, Dr. Merizalde, thank you so much. I always learn something from talking to you.
My pleasure. Thank you for having me.